the Airway Clinical Research Center at UCSF.
Asthma is a common disease affecting as much as 10 to 15% of the population of the United States. Typical symptoms include chest tightness, wheezing, shortness of breath, cough, and production of sputum or phlegm. Some patients have all of these symptoms. Others may have only one or two. In fact, we've discovered in recent years that all asthma is clearly not the same. Many patients develop asthma as children, but perhaps 30 to 40% of people have their first ever asthma attack as adults. In some patients, asthma is triggered by allergies. In others, respiratory infections or exercise, air pollution, changes in the weather can trigger an asthma attack. Just as the presentation and the symptoms can vary between individuals, the response to treatment can also vary. We know, for example, that different patients respond differently to some of the standard asthma medications. This may be due in part to an individual's racial or ethnic background. For example, there are data to suggest that the response to some medications may be different in African American and or Hispanic patients compared with Caucasians. Members of our group are studying the genetics of asthma to try and understand this better. We also know that some of the cellular processes that lead to manifestations of asthma are different in different patients. We think of asthma as an inflammatory disease, which means that too many of the blood cells that normally circulate throughout our bloodstream and usually play a role in fighting infection have migrated to the lungs and airways and have set up housekeeping there. There are different kinds of inflammatory cells, and it looks like the kind of inflammation predicts the response to different treatments. We're studying whether simple tests done on blood or sputum can help us choose the best medication for a given patient. This approach is known as personalized medicine, or now more commonly precision medicine, and is designed to help pick the very best medicine for each individual patient. We hope that this leads to better asthma control and better quality of life for patients with asthma.